Dear students, welcome back. Now we will discuss about the tibiofibular joints. There are three joints which forms the tibiofibular joints. One is the superior tibiofibular joint and middle tibiofibular joint. This one is superior or proximal tibiofibular, and this one interosseous membrane which is attaching the tibia and fibula all together called as middle tibiofibular joint. And next one is the inferior or distal tibiofibular joint. All these three together called as tibiofibular joints. Now we will see one by one. The first one is the superior tibiofibular joint or proximal tibiofibular joint. It is a synovial joint of plane variety. The articular ends are the articular facet on the lateral condyle of the tibia articulates with the facet on the head of the fibula. So the articular facets are more or less flat and covered with hyaline cartilage. And this joint is enclosed by a capsule which attaches along the margins of the facets. The inner surface of the capsule is lined by synovial membrane. Okay. And next ligaments to this joint or the anterior ligament and posterior ligament. Here you can find the anterior ligament, anterior tibiofibular ligament. This one, anterior tibiofibular ligament, stretches from the front of the head of the fibula to the front of the lateral condyle of the tibia. Okay. Next, posterior ligament, which is passing upwards from the neck of the, here you can see, from the neck of the head of the fibula to the posterior aspect of the lateral condyle of the tibia. Okay, these are the attachments, ligament attachments of the proximal tibiofibular joint, and this joint is supplied by the recurrent genicular branch of the common peroneal nerve and nerve to popliteus. The movements which are taking place here are the gliding up and down movements. Gliding up and down movements. Okay, now we will see the middle tibiofibular joint. The type is fibrous joint. The articulating ends are the shafts of the tibia and fibula. Okay, and if you see the ligaments, actually it is a crural interosseous membrane. The fibers mostly run downwards and laterally. Here you can see mainly run downwards and laterally. From the lateral border of the tibia, to anteromedial border of the fibula, Only a few fibers run in the opposite direction. Okay. So this is about the ligament. Above, there is a gap through which anterior tibial vessels enter into the anterior compartment of the leg. Below, the membrane is continuous with the interosseous ligament of the inferior tibiofibular joint. So this is about the middle tibiofibular joint. And if you see the nerve supply, this one is also supplied by the nerve to popliteus. The main function is it holds the shafts of tibia and fibula together and strengthens fibula for muscle attachments. This interosseous membrane also provides some additional surface for the attachment of muscles. Okay, now we will see the distal tibiofibular joint or inferior tibiofibular joint, which is called as the type of the joint is fibrous joint, and this one is called as syndesmosis. Okay, articular ends are the rough area on the lateral surface of the lower end of the tibia. Okay, and rough area on the medial surface of the lower end of the fibula above the facet for talus. So this inferior tibiofibular joint also takes part in the ankle joint. Yes, yes. Okay. So if you see the ligaments, it is having ligaments on anterior side, posterior side, inferior side, and also the interosseous membrane. Okay, so anterior tibiofibular ligament connecting the anterior margins of the rough end areas of the articular parts of the two bones directed downwards and laterally. Okay, if you see the posterior tibiofibular ligament connecting the posterior margins of the rough area of the articular parts of the two bones, it is also directed downwards and laterally. If you see the inferior transverse ligament, it is the lower and deep fibers of the posterior tibiofibular ligaments, which is a strong band passing transversely, okay, passing transversely from the upper part of the malleolar fossa of the fibula to the posterior border of the articular surface of the tibia. Okay, so this one is almost as far as the medial malleolus. That means the ligament which runs like this. Okay, the medial malleolus will be present here. The ligament from the malleolar fossa, it moves somewhat backward position of the medial malleolus. Okay, next one is the interosseous ligament. It lies between the anterior and posterior ligaments and passes between the adjacent rough articular surfaces of the tibia and fibula. It is continuous above with the crural interosseous membrane. The nerve supply is mainly by the deep peroneal, tibial and saphenous nerves which supply the inferior tibiofibular joints. The movements which are taking place here, we can see only some gliding up and down movements in the proximal tibiofibular joint, and the distal tibiofibular joint helps in the movements of the ankle joint. Okay, so these are all about the tibiofibular joints. Thank you.